I'd like to
Recording in progress.
call the meeting to order. Roll call. Carrie,
Present.
Paula,
I'm here.
Kevin,
Here.
Joan.
Here.
Great. Before we get started, I'd like to welcome our newest board member, Joan Wetzel.
Joan. Hi, Paula.
Hi, Joan.
Hi.
Hi, Joan.
So I thought what we might
Hi,
do
everyone.
is maybe ask Joan just to give us a sentence or two on your professional background and how long you've lived in Reading, and then maybe we can go around and similarly do the same just to introduce ourselves to Joan. So Joan, go ahead.
Hi, I'm Joan Wetzel. My husband and I have lived in Reading for 44 years now. Our sons went through all the Reading schools and graduated in 01 and 03. I have a degree from Northeastern in medical laboratory sciences. I worked in labs for 40 years, primarily in microbiology. I worked at a hospital for 12 years, and then for 27 years, I worked at a local, very large pediatric practice in their laboratory, primarily in microbiology again.
Great. Well, again, welcome.
Thank you.
So I'll start the round robin. I'm Rick Lopez, and I'm a retired primary care physician and physician executive. I've lived in Reading for 30 years, and I've been on the Board of Health for about 4 years now.
Okay.
Carrie.
Hi, Joan. My name's Carrie Donnell.
Hi.
I have lived in Reading since 2001. We have one child who went through the Reading schools and actually went on and had a really great academic career at Tufts and a biochem major. Yay, Reading schools. They did well by him. And let's see, I have worked in public health since 2002. Prior to that, I worked in a small business for a 7-store small business for 10 years. Worked in the mutual fund industry for 10 years. Went back to school, found public health and municipal government, kind of fell in love. Came up in emergency preparedness and spent a lot of time in that, but I also have also did a lot of work, coalition development and training development. There's a local public health workforce training initiative that I managed for a few years, and currently I am managing a shared service arrangement for 4 communities and a training hub for 40 communities. So I have my hands deep in public health. I love it. And I joined the board in June of 2020. My experience with public health emergency preparedness and all my hospital work said I can't sit by. So, and I'm really
very impressive.
Thank you, Carrie. Paula.
Hi, I've lived in Reading for most of my life, went through the Reading school systems myself, married my high school sweetheart, and all 3 of my kids went through the Reading school system. I became a nurse and worked at Mass General for 37 years, the last 15 of which I worked as a pediatric nurse practitioner. I also taught at the MGH IHP. But I'm retired from all that now. But I've been on the board since the same time as Carrie, right through COVID.
Wow. Very good. Wow.
Kevin.
Hi, Joan. I'm Kevin Sexton. Been a resident here since 2009 now, so I've been here for a little bit. Been on the board, I believe, since 2018. This is going to be my 6th year, if I'm correct in that, somewhere in there. I don't have a medical background, but I do have a governmental background, being a selectman here in town, a former selectman here in town. So I'm kind of that corner of this board.
Okay.
And Kevin did yeoman service during COVID. The other
Absolutely.
folks that he worked with had stepped down, have moved on from the board since then. But Kevin, don't hide your light there. You were on the board in a important time, and you guys went through it.
It was interesting. Put your head down, keep moving.
That's right.
I can't
We call
imagine.
Kevin our parliamentarian.
Yes.
I
yeah,
do.
It keeps us honest.
Yes, he does.
And I would ask Ade, do you want to just introduce yourself to Joan?
Hi, Joan. My name is Ade.
Hi.
My name is Ade Solarin. I'm the health director for the town of Reading. I've been in this position for about 2.5 years now. A little
Okay.
2.5 years. I have a master's of public health degree, and I also have an undergrad in pre-med biology. I've been in the field of public health since 2008.
Okay.
Welcome aboard.
Thank you very much. Nice to meet everyone.
Can I ask a question? Clarifying
Sure.
question, Mr. Chair? Does this mean
Yes.
that we are officially a board of five
Five.
now?
Yes.
Is Jerry our 5th?
No,
Joan is our 5th. Kevin was reappointed.
Oh,
Um,
okay.
Jerry's continuing to be an associate as far as I know.
Oh, so Kevin is now, you're a full-fledged.
correct.
Yeah.
Yes.
He
Well,
is.
This all
congratulations.
happened at Tuesday night.
Right.
So it's been kind of warp speed to get
Yeah.
Joan here in 48 hours, but
Yes.
Fantastic.
That's
And
wonderful.
I would like to ask if everybody got sworn in.
I did.
Yeah.
Oh, okay. And I would also like to introduce Jen. She is a health inspector, and she's been here for almost 2 years now.
Where's this time gone?
Go ahead and introduce yourself, Jen.
I
It is
just
Jen.
can't believe it.
No,
Yeah.
I've been here over 2 years now.
And we have Cassidy. She's a health administrator.
Hello.
Hey.
Right.
Thank you.
Health administrator par excellence.
Yes,
We're
for
very
sure.
fortunate
Keep
with our
us
staff.
organized.
Very fortunate, yeah.
Okay, so in terms of tonight's agenda, we're going to review the minutes for March 14th, public comment, if there is any. And then we have sort of introductory brief discussions around the 2022 food code, nicotine-free generation, kind of where that's at, as well as the community health improvement plan hearing. I wanted to share a little bit around the opioid settlement funds, and I attended that conference a couple weeks ago. And I was asked for feedback on the town charter as it relates to the Board of Health, and I had a couple questions for the board in terms of how I should respond. And then we'll wrap it up with a day's monthly report and so forth. So in terms of the minutes of March 14th, any comments or edits? I'm looking to Paula. Yes, Paula.
Couple of little ones. Under the
Okay.
paragraph with, that says, it starts with Randy Fiore.
Yes. Yep.
Okay, yes. LaFour, not Fiore. It says, Maureen Busby steps in, oh no, sorry, not, next one. That after the youth left the store, the evidence was. No, back again. Maureen Busby steps in and states she used, should be a D, to
Right.
have a protocol.
Yep.
And under 166 high,
Yes,
the word premises needs to have an S on the end of it. I think, unless I'm mistaken. Birds on the
premises.
premises.
Yes, right.
That's
You
it.
got that, Cassidy?
Otherwise, it was great.
Oh, good. Okay, with those edits, I make a motion to approve the minutes from March 14th. Roll call, Carrie?
Wait, I'll second your motion.
Oh, yes. Phew. Almost blew that one. Second my motion. Roll call now. Carrie,
Yes,
Paula,
Yes,
Kevin,
Yes,
Joan.
Yes,
You know, it's actually a lot of times people abstain when they weren't present, but I've actually read Robert's Rules of Order. You can actually approve
yes.
the minutes as long
That's
as.
okay.
So that's good.
Well,
Very
yeah,
good.
I was wondering about that, so I'm glad to know.
Yeah, that is good. In terms of public comment, do we have anyone who wants to make a public comment? I see one resident, Narcissa Lyons. I don't know if she's just listening or would like to make a brief comment. Not hearing
Cassidy, can you?
anything. Narcissa, if you'd like to make oh, okay. If you'd like to make a comment, go ahead. Otherwise, we'll move on. Oh, okay, you're unmuted now. Narcissa, you're unmuted.
Yeah, I'm sorry. I had my mic on. I was just wanted to say I don't have any questions. I'm just here to listen and learn.
Okay, great. Welcome.
welcome, yes.
Okay, so I'm going to hand agenda item 5 over to Aday and take it from there.
All right, thank you, Dr. Lopez. So basically item 5 is just a review and consideration of the 2022 food code for future adoption by the Board of Health. I'll start by explaining what the retail food code is and talk about why the board should consider adopting the 2022 food code. I'll then hand it over to Jen to discuss the significant changes moving from the current food code to the 2022 food code. So what is the Massachusetts Retail Food Code? It's a 105 CMR 590. It is the state regulation that provides sanitation standards for all food establishments. It incorporates the 2013 FDA Retail Food Code and its 2015 supplement. Massachusetts General Law, Chapter 111, Section 127A requires local boards of health to enforce the Retail Food Code within their municipalities. All operations that meet the definition of food establishment in the Retail Food Code must comply with the regulation. Generally, a food establishment is any operation that serves food directly to the consumer. Examples of food establishments include restaurants, satellite or catered feeding locations, catering operations, and residential kitchens in bed and breakfast or cottage food operations. The Massachusetts Retail Food Code, which contains the 2013 FDA Retail Food Code, is a set of minimum standards. To the extent that a municipality's regulation or ordinance falls below those standards, the state standard prevails. So in other words, municipalities are allowed to adopt a new version of the FDA Retail Food Code as long as they are more stringent than the 2013 FDA Food Code. So, we've been thinking about this for over a year now, Jen and I, and we believe that this is the right time for the board to consider, reviewing and possibly adopting the 2022 food code in the near future. First of all, it is the most current food code, and we will be working with the most current laws governing food sanitation, and that would, keep us up to date with current food safety protocols. And also, the most important reason is that all the municipalities in our collaborative are moving to adopt the 2022 food code so that we can standardize food inspection protocols across the board, which will make sharing resources such as inspectors, food inspection software, equipment, and things like that. It's just going to make it easy across the board. So with that being said, I'll hand it over to Jen for a quick presentation regarding the significant changes moving from the current food code to the 2022 food code.
All right, thanks, Day. All right, so what you're going to see in front of us is I'm going to go through about 8 different updates that were just important to the change in the food code. Right now we operate on 2013. Just so the board knows, I did study for my CPFS with a 2017 food code, so I am quite familiar with it. So you'll see some things, you might look at them and say, do we do that in Reading? There are some things that are very important that restaurants yet are not doing in Reading, but restaurants are ever advancing, so it's good for us to know them. I think the most important one I'm going to go through is the first one. So the 2017 FDA food code specifies that the person in charge must be a food protection manager, and this requires 1 person in the restaurant per shift. So that being said, right now, you could own Bob's Burgers and you can have a food safety manager protection, but no one else in your restaurant needs to have it. And if the owner is not there or the food protection manager is not there, the education of food safety is not being passed down to other persons in charge or staff. So with the 2017 food code change, all restaurants would be required to have 1 food protection manager on per shift, which is super important. Next will be the raw animal foods. The 2017 FDA food code changed the cook time and temperatures for ratites, non-intact meats, the comminuted fish, meat, and game to have an internal temperature cooked to 155 for at least 17 seconds. There's not much of that in Reading, so, but it's definitely good to know. Cook, chill, and sous vide. We do not have any locations in Reading that do cook, chill, or sous vide, but that was a huge update with the food code because so many restaurants are starting to do those type of things, which, there's ROP packaging that's involved in this. So you'll see that the FDA, the 2017 code added that establishments that package time temperature control for safety food using the cook, chill, or sous vide process must ensure that the food is cooled to 41 degrees in sealed package, and then it must be cooled to 34 degrees. And if it's not chilled to 34 degrees within that 48 hours, it's only good for 7 days. But if they do the minimum or what they're supposed to do with the 34 degrees within that 48 hours, that food can be held for another 30 days instead of the 7 days. Again, we don't have any of that in Reading right now, but it's super important. TCS, or time and temperature control. So this is going to be a clarification that food may have an initial temperature of 70 degrees if there is an indication of when it must be discarded. So I guess the easiest example I can have is you can walk into a pizza shop and you'll see that they'll have just pizza sitting in their holders, not maybe a warmer. They need to be marked for 4 hours. If there's no indication of it being marked for 4 hours and the temperature is under 70 degrees, it must be discarded. But if it is within that 4 hours, it is okay. So this does happen in Reading. We do have some locations with TCS items that you can hold for the 4-hour time and temperature. We'll go to allergens, which are super important. We know we added a 9th allergen this January 1st, 2024, which is sesame. So then 9 major allergens. So the 2022 food code requires that all major allergens food allergens be labeled on any bulk or unpackaged food item available for customer service. I don't enforce it. I've recommended it. So I've always put the recommendation out there to establishments, even the grocery stores, to make sure that their allergens are visible on anything, even grab and go stuff. Make sure the labels are correct. We haven't been able to enforce it, but it's definitely they know that I highly recommend it. The next one, hand washing sink installation, was a shock to me. Hand washing temperatures, the water only needed to be 100 degrees. Now it only needs to be 85 degrees. So there's scientific studies that you don't need 100-degree water to wash your hands. It only needs to be 85. Hope you're working your soap in properly and getting all the crevices. The next one is something that we see commonly, especially with temporary food events. The code removed the ability for some food establishments, such as low-risk mobile food, to use chemically treated towelettes in place of hand washing sinks. That's really important. Like, I would say bake sales, things that you're not doing food prep on site. If you're just serving food, like even a hot dog cart, that's very simple, minimal. It's okay to use a towelette versus having to have a hand sink. The last one will eventually be up to the health department, but it allows for pet dogs in outdoor dining areas with the approval of the Reading Health Department. It may allow the pet dogs into outdoor dining areas as long as you have a separate outdoor entrance so the pet dog never enters the dining room. I believe in Reading, I would say it would be like a Bunratty, and maybe a public kitchen. So those are the major updates between 17 to 22.
Jennifer, can I ask a question, and
Yeah.
anybody else, I should feel free. What is a food protection manager, and what do you have to do to get that title? Is there a lot of education involved, or how does that work?
So it's not difficult to get. It is a nationwide certification. It is a proctored exam. There are different courses of study. You could do a 6-hour course, an 8-hour course. You can divide the days up. There is a book. I'm actually certified to teach it and proctor it. So it definitely is something to study for. People will say that it's difficult if they're not used to being in the restaurant industry, but it's actually not. But it is a proctored exam nationwide, and it is good for 5 years once it's complete. But you do need to renew every 5 years, as food safety is updated every year.
Okay. Thank you.
Mm-hmm.
And it is pretty much transferable. Like, you can, if you stop working at establishment A, you can take your certification with you and work for a different establishment, and it still applies. So, and I also want to mention, Cassidy, can you go to the bottom page, the last page? If the public wants to review the code, they can go to www.tinyurl.com//22 food code and view the full 2022 FDA food code. If this is the direction the board, wants to go in, I believe that we need to have a public hearing so that we can get input from food establishment owners within the town of Reading. And since we are already going to be having those other 2 public hearings in the future, we can just include this hearing as well and have, 3 consecutive hearings and just have everything the same day.
Makes sense to
So
me.
Ade, there's no reason for today. This was an introduction to the highlights of this new code. And we would have a public hearing in the next few weeks and then come back to it to either formally adopt it or adopt it in part or whatever.
Correct.
Right.
Correct.
Okay. Any other thoughts, questions, or anything else on this? And I'm curious how long if I went to this link, how long is the code that's published?
Code is absolutely very long.
Very long. Okay.
It's huge.
Yes.
But I
Okay.
mean, it's going to be posted on our website. If anybody wants to read it, they're
Yeah.
welcome to do that. It's going to be posted for weeks prior to the hearing, so people can, be prepared to have a conversation about it at the hearing.
And Ade, I think you also mentioned that before, that would we send out notifications to our 100 odd food establishments about specifically that this hearing, so that, because I think they're the most involved and obviously affected. Is that right?
Correct. Yes.
Okay, well, thank you, Jen.
Thank you.
Thanks, Jen. You're welcome to
Thanks.
stay, but if you want to leave, that's fine.
Thanks, Jen.
You're
Thank
welcome.
you.
Bye,
Thank
guys.
you.
Thank you.
Bye-bye.
Okay, Ade, nicotine-free generation.
So I would like to reiterate that this is not a public hearing. It is about scheduling a public hearing for the nicotine-free generation consideration and the community health improvement plan input from Reading residents, and possibly the 2022 food code consideration and future adoption. It is not a public hearing, okay? The board is just picking a date and a format for the hearing notice. The public will have opportunity to discuss these topics, during the public hearing. Let's see. Can you please put up the notice? Okay. Also, I will post draft copies of the considerations on our website for the public to review in preparation for the hearing once the board approves the date, time, and the format of the hearing notice tonight. Again, tonight the board will pick a date, time for the hearing and review or approve the format for the hearing notice. It is not a public hearing. Okay, so my proposal is to have 3 consecutive hearings for the review and consideration of the nicotine-free generation policy, the review and consideration of the community health improvement plan, and the review and consideration of the 2022 food code. All right, so let us start with the review and consideration of the nicotine-free generation policy. All right. The tobacco-free generation proposal advocates legislation precluding the sale and supply of tobacco products to individuals born after a certain year. This proposal will essentially end the legal provision of tobacco products to the generations that have not yet commenced consumption. So, looking at this hearing notice on the screen, what date and time does the board want to hold this hearing?
Looks like you're proposing May 13th. Is
Correct.
that right?
Correct. Proposing May 13th, 7 p.m. just for the, nicotine-free generation policy. And then depending on the turnout, I'm thinking maybe 7:30 or 8 o'clock, we can go to the next one, which is the review and consideration of the community health improvement plan. And then maybe 8:30, we can go to the review and consideration of the 2022 food code.
So May 13th a day, is that that's our next regularly scheduled board meeting time? Yes?
No, that's a
Mhm.
Monday, isn't it?
No, that's a Monday.
Yeah,
Okay,
The
so,
next
yeah,
Board of Health meeting is May 10th.
okay.
No, May 9th, sorry, May 9th. I believe that the hearing for the nicotine-free generation policy would probably draw a huge crowd.
Mhm.
So I'm thinking we should give it at least an hour, maybe.
if Monday's a good
So-
day for everyone else, that's fine by me, but I do have something else that I do on Mondays, but I can cancel it if it's a good day for everybody else.
Or the other option is we can propose some dates tonight, and then we'll send out a poll, for everybody to choose from and go from there. But we can have some dates picked up tonight.
Okay. Kevin, did I see your hand up?
Yeah, I would just say, from a turnout standpoint, I'm thinking the 13th is probably not going to be the best night to pick. Not that it matters to this board or affect this board in any way, but there's going to be a lot of people, I'm sure, helping out campaigns for the election that is going to be the day after. So if you really want to draw the most amount of folks out, you may want to get it on the 20th if you want, like Monday. I think you get a better turnout.
Yep. It's a good point, Kevin.
I didn't, so the election is on May 14th. Okay,
Correct.
yeah. So, so I would be fine with that, or the 21st, which was a Tuesday. I know, Day, you were a little concerned that with respect to the community health needs assessment component, I think Jamie wanted to kind of wrap things up sooner rather than later, but perhaps a week isn't necessarily a big deal.
Correct.
The only thing, and maybe I don't, maybe we ask our parliamentarian, if we schedule times and we either run over or run short because there's less, people, how does that affect the legitimacy of our posting in terms of, we said that the community health improvement plan is at 7:30. Turns out that it turned out that it's going to be 8:15. And does that mean that we weren't following protocol?
As long
Is
as we
that an
meet
issue?
the minimum requirement, so if we say 7 to 7:30 and it goes over, I don't think there's an issue. But if
Okay.
we say that, oh, nobody's showing up, and then we're just gonna wrap this up at 7:10, then that's the problem.
So we'd have to be sure that we sat there in a lot of time, that we had stated and publicly
Correct.
stated.
Correct.
The other thing I just mentioned to the board members, the idea was this is would be a in-person hearing.
Mhm.
And so just in terms of logistics. A day,
Should I
go ahead.
just put something out for that entire week of May 20th? Let's say, 20, 21, 22, 23 at 7 p.m.
Yeah, why don't we, and then the board members can respond and see which ones work.
Okay, and do we think an hour would be okay for the tobacco-free generation policy hearing? Or do we want to do less than that or more? I know that you.
I'm concerned that if we're gonna have establishments people from the establishment selling tobacco products there that it's gonna take up more time than we anticipate. I don't know.
one
I
thing you
don't
can always
know.
do
I'm
is-
just concerned about it.
All you really need to get through on these nights technically is the public comment part of it. You can always continue these as well if it comes
Okay.
down to it. So you can close the public comment or the public hearing part of it and continue it to the next board meeting the next week, the next few days, whatever posting is needed to. But so as long as you get through the public comment, that's the big part of it. And like they said, you can't technically go on to the next aspect until the time allotted. So you can't move on to until from one to the next. You have to kind of sit there and wait. So if you go under, maybe it's not a bad idea where you wait or you take a 15-minute break and come back or something like that. But just a couple different ways to look at it.
Right, because the
Um,
hearing is a airing of what the issue is and opportunity for feedback. We'll close the hearing. We don't have to deliberate at that point. We can move to deliberate later. We vote later and so on. It's the window
Right.
for hearing feedback from stakeholders.
Right.
Right.
And, one thing you might do is in terms of the timing would be ask Maureen because, Wakefield, Stoneham, Malden, they've all had these hearings and she might have a good sense of how long this particular topic would go.
That's a
Okay.
good idea.
So are we in consensus that the week of the 19th, May 19th is
Yeah,
a good week?
yes, I think so.
Okay. All right.
We just pick a day, have to find a day.
Okay, perfect. I would talk to Maureen about it and we'll figure it out.
Okay,
With regards to the birth date, we know that more than 80% of smokers start by the age of 18 and virtually all by the age of 26. The primary initiators of teen consumption are based mainly on peer influence and the desire to appear grown up or look cool. Therefore, preventing youth initiation may be the key to ending, the tobacco epidemic. So essentially, the tobacco-free generation proposal will prevent the supply of tobacco products to those born after a specified date and year. So pretty much, the board needs to pick what birth date will be the cutoff date. Cassidy, can you please, yes. And I'll hand this part over to Dr. Lopez.
yeah. So the question is, as the day said, we, in option number one on this table, if we say that effective in January, this would probably be, if we ultimately approve it, it would probably be effective 6 months later in January of 2025. If we pick a birth date after which nicotine products cannot be sold to an individual, if we picked January 1st, 2004, we're basically providing no buffer. People who turn, as of January, when the law goes into effect, if we were to proceed with it, it would immediately be effective for people who are about to turn 21. If we move the birth dates down, we're to 2005 or 6 or 7. And I think January 1st is just a convenient way to keep people on the same page. If we move the birth dates down, we're actually delaying the implementation. We're providing a buffer so that people who turn 21 come January, could still buy because we picked a date of January 1st, 2006, for instance. So the question is, do we want any essentially delay in the implementation, a little further down? I mean, this table runs for eight years. That's pretty long. But, in my mind, the pros would be, it wouldn't impact right away. If you delayed the date, it'd be a year or two or three. The downside is, nicotine's certainly not a good thing. And if we felt this was a good approach, we'd want to do it sooner rather than later. I think that, I think the other towns, Stoneham, Wakefield, and correct me if I'm wrong, Ade, I think they picked 1/1/2024 as their, I'm sorry, January 1st, 2004 as their, the birth date after which you can't purchase. So that's what those towns have done. I think it's, in my mind, I'd probably pick that date just because if we were going to go there, it's important for us to put a date down so that it's correct on the public notice for the hearing. We can always change it come when we hear the feedback and we have a meeting where we decide to take a vote. So one option could be just to go with the 1/1/2004 because all the towns are doing it, hear the feedback from the public, and then make a decision when we vote on this. Any thoughts, comments? Paula, yes.
Am I wrong, but I thought I saw somewhere that Maureen had suggested that we might want to do the 1/2005 because we're so far behind the other people that have gotten further along in the process.
Correct. It was in one of the meeting minutes that we turned into the board.
Okay, good point. Yes, Kevin.
It's funny, Paul, that you remember that. I didn't remember her saying that. I thought that, so for me, it was always, if you look at this, well, one, I always look at implementation things in that nature. This is much more effective done on the state level, which most likely, if enough towns do it, will get adopted in that direction would be my guess. So the way I see it, somebody doesn't turn 21 and jump for joy that they can go down and buy cigarettes down at the store, right? They've already been smoking at that point, or they're just not even going to take it up. So we don't allow anyone under 21 to purchase tobacco products. It would be consistent to go with the 2004 because you're not allowing it anyway. So it's not as if you're taking it away from somebody. If you do it in the 2005 age bracket, right, you're delaying it a year. So right, so then that ability for them to purchase in town, you are going to take it away from them. They haven't had the ability to purchase in town in how many? What, a year now? 2 years? 3 years? Wait, how long has it been? Longer than that. So to me, it makes sense to just keep it simple that way, right? They haven't had the ability, and this will not give them the ability.
Right.
Okay.
Inclined to, sorry, Paul, I'm cutting you off. Go ahead.
This doesn't apply to things like Zyn, correct?
It will be any product that contains nicotine.
Okay, good.
Rick, if I may,
Karen?
I'm inclined, I'm inclined to agree with Kevin that I like the idea of not conferring, of not altering the right and just sort of setting the line saying you haven't been able to date, and you're just gonna continue that. So, I mean, I do remember Maureen talking about the cleanliness of the line, and I'm not, I just don't have quite the recall that Paula has on the details of it. So I would say that we want to be, we want to err on the side of not taking away, not taking away a right, and just say this is it, you can't, and you're not going to. And then I think you're right, Kevin. I think that, as as the interest in this grows across the Commonwealth, this will become something that the legislature will start to consider, and figuring out what the year of implementation will be one of the pieces that they'll have to consider as well. So if we can be in line with our folks, our neighbors, makes it easier for inspectors. I'm glad we're going forward with this. Thanks for raising all the details on it.
So I would, thank you, Carrie. So I think we should just leave the 1/1/2004 as a placeholder, and we'll hear the public feedback, and we'll have a month to think about it. And I guess the earliest would be in our June meeting. We can have a discussion and decide to stick with that or make a change. But for now, why don't we just leave it as is, consistent with the other towns. In terms of if we can go back to Cassidy, the legal notice, right. So, Aday, do you have any comments about the community health needs assessment and that part of the hearing?
We just need to figure out a time, and how long is the hearing going to be for?
Okay.
So sorry, go ahead.
Go ahead.
No, I'm never mind. I cut you off.
We don't necessarily have to have a consecutive hearing. If we want to break it apart and have one hearing per day, we can do that as well. It doesn't have to be consecutive. I was just under the impression that we could save some time and just have a consecutive hearing and get this over with. But we can break everything apart.
Mm-hmm. Right. I mean, the question is making sure we provide adequate time to hear from stakeholders so that we have a clear, set of feedback that inform our own deliberations and decisions about how we'll vote at a future meeting. So, I mean, maybe we do 2 hearings on one night and one on another.
What we could do, as Aday mentioned, Kevin, I think, mentioned, we could, I mean, anyone's guess. The nicotine-free policy, probably Maureen could help us with how long that needs to be. The other 2 is anybody's guess as to how long or how many people will show up and want to comment and so forth. So I would just put a placeholder in there after the nicotine-free generation. I do, perhaps 45 minutes each for the second 2. And as Kevin mentioned, if we're running over, we will just end the public comment, and we'll have to either schedule another hearing or have it at our next board meeting and do it that way. I think that would be probably the most efficient.
And can I ask another sort of process
Sure.
question? So when the notice for hearing is posted, it will include the detailed information of the rights and authority under which this issue is being considered, and citations of Mass General Law and the federal and state requirements and opportunities, right? It's not just hey, there's going to be a hearing to talk about cigarettes, come. Is that correct?
Yes, so on the notice, we would give people the link, on our website to actually go and read the documents.
Okay. Great. Thank
So
you.
so with respect to that, there's clearly the draft document for the community health improvement plan. So that draft will be posted. Is that correct today?
So what I'm understanding right now is we want to do the nicotine-free generation separately, and then the chip and the food code together on a separate day. Is that correct?
No, I think we were saying we would give enough time for nicotine-free, whatever Maureen thinks would be reasonable, and then book the other two at 45-minute intervals. And if they run over, we can end that period and resume it at another date.
Okay.
But getting back to my question, would the draft document be available then on the health department website?
Yes, it will
For
be.
the child,
I
yes,
wouldn't post this notice if those documents are not available.
right. And do you know if Jamie will have something written with respect to our initial community health improvement plan ideas, or
Yes, she should
she will?
have something to us by next week, and that's
Okay.
what will be posted that the community,
Okay.
read up on our
Yep.
website.
Okay. And and for the food code, you'll have that link that Jennifer talked about.
Correct.
Okay.
And we'll also have the link to the full 2022 FDA food code, and people can go in there, read a good bedtime story.
Sure. And so Cassidy, if you scroll down a bit, there was one item down there. It says the very bottom, in bold, to the Chronicle, please publish on May 13th. But we want to publish it 2 weeks before. Isn't that
Yes.
correct?
Yes. So
Okay.
this is just like a draft. All those,
Okay.
we're gonna fix all those prior to posting.
Okay. So we'll determine a date, and then when we post it, it'll be at least 2 weeks before.
Correct.
Okay, great. Okay. I think we covered what we needed to in terms of the dates and the logistics and what will be available to the public. Anything we're missing, or we can move on? Okay. So let's move on to agenda number 8, just in terms of the opioid settlement funds. And Cassidy, if you can put that PowerPoint up. So this is just an informational thing that I put together, which was kind of striking to me, as I'll point out. So a couple weeks ago, the state had I think it was it a 2-day? I think it was a two half day session on the opioid settlement funds. And if you go to the second slide, Cassidy, basically, as you know, these funds were generated by lawsuits against opioid producers and sellers, and distributed by the states. Massachusetts decided to distribute 40% of the funds to cities and towns, and they specifically listed here the kinds of things they're looking for cities and towns to that they might do, being closer to their communities. If you go to the next slide, what was striking to me was that if you look at the funds that were distributed as of last June, it's like $1 million in funds, and only 21,000 was in fact utilized, and that was by the town of Reading, which was done by the coalition. They had the memorial service at the center of town. They've done Narcan training. They've done some educational things in the schools, and that's what that funding went to. I also found from Kaiser Permanente Health News, they had a table that you could look up of what future funds would likely be coming to the towns. So the funds are not just a one-time thing. It's a large amount, and it's over a period of, I don't know how long, 2, 3, 4 years. And so I listed here, what the funds were anticipated for all these towns going forward, another 4 million. And so the reason I just wanted to highlight this, and we can go to the last slide, is that, the burden of this crisis is significant in these towns. And over the last 5 years, you can see the number of deaths, and Haverhill clearly has a major problem, and the number of ED visits. And so it's something that I think we should be thinking about. I'm not proposing anything right now, but as we should be thinking about with respect to our first priority around behavioral health, mental health, and substance abuse or substance use disorder, that these funds are out there, and that if we did it collaboratively, there's $1 million to be spent just amongst the 6 towns. Or if we did something in Reading, there's still a lot of money to do. Carrie, you have your hand raised. Yep.
Thank you for attending the conference for us all. That I appreciate that time commitment. Thanks for the information. I am eager to kind of learn more about how Reading is proposing to use the funds. I know that there is, there are requirements for, or maybe requirements is too strong a word, but strongly suggested ways in which, communities ought to be identifying what is the best way to use the funds, right? There's a expectation that you'll be soliciting community input and that you'll be making sure and draw on folks with lived experience. There's an expectation that you'll be considering whether there are service inequities, whether there's some kind of, whether perhaps the availability of harm reduction is less in our area. And so that's something that we ought to be considering putting dollars towards. And those things all require like a more deep understanding of the nature of the impact and the nature of the problem here locally. So I'm curious to hear what the coalition is thinking about this. And I think of them because they are the coalition. I know the funds are delivered to the town. They're not delivered to the coalition. They're delivered to the town for then going through that process and identifying what the best ways to do it. And then I think I'm just going to put in a little plug for, the spending of the dollars, particularly if there are going to be additional dollars coming in. Procurement rules are complex and for good reason, and wanting to make sure that we're spending our money. Perhaps there's something that if we wait, so we've got the 108, but knowing that the additional dollars come in do we build a multi-year strategy that says, yes, we could set up some kind of program of assistance over multiple years, knowing there are further dollars coming in. So I think it's great timing. I love that coincided so nicely with our, another indication of how good our process was for our own community health assessment. And I'd like to know from the coalition, and I guess from the town manager, what the plans are for process in terms of stakeholder meetings.
I think this
And
would be a good topic to have Erica come back. We haven't seen her in a while, and a day, yeah.
Yes, so I spoke with Erica, and she's willing to attend one of the meetings. She is willing to attend the May 9th meeting. She has some details she would like to share with the board. So
Okay.
yeah.
No, that's good. And you can feel free to share this PowerPoint with her as well.
Yes, I did. I did.
Oh, you did.
She
Okay.
made some comments to me that I would like to keep private.
Yeah, can imagine. All right, so this is to be continued.
Can I ask one question quick?
Sure.
I'm trying to get up to speed here. Is there a date that this money has to be spent by?
I
there are
don't,
reporting requirements, but the money doesn't, the money doesn't expire like other grant funds might.
Yeah.
Doesn't have that same.
Yeah, that was my understanding.
So there's no time pressure to spend the dollars.
Correct.
No.
Excellent.
Yes, but Erica will be in the position to give us detailed information. I believe there is something about a 4-year limit. I'm not 100% sure, but she has more details, and we will hear from her at the next Board of Health meeting.
Okay, good. That's good. And then the next item is the town charter. And so I got, and I don't know if everyone got it or just I got it, but everyone got it. Yeah. Every X number of years, I think it's every 5 years or something like that, the town needs to go through a process to update its charter. And so the proposed revised charter, and there's a committee working on this chaired by Chris Haley, sent it out to boards and commissions and committees in the town to get their input in terms of whether any of the changes, they had any suggestions other than what was being proposed. And so I got this, and Cassidy, if we can go to page 18. Okay, so we have 4.4 here is the Board of Health. This is the only part we're, asked to give comment on. And it updates, it really has the 5 members. And it says for 3-year terms arranged so that 1 term shall expire each year. And then the second paragraph simply says, the board has all the powers and duties granted by the Commonwealth general laws. So I had 2 questions that I wanted to get feedback on. One is there is no mention here of 2 associate members.
Mm.
It's just the 5 members. And, should we ask that there be 2 associate members put in there? How do people, I guess there are pros and cons, more members, more input, more diverse opinions, but more members potentially can logistically, slow things down perhaps. I don't know. I mean, I can see both sides of that. So that's one issue. Should we recommend that 2 associate members be literally written into the charter? And then second, with 5 members, and if each has 3-year terms, the math doesn't work with having one term expire each year. That was fine when you had 3 members and 3-year terms and the terms, and that was great mathematically, but this doesn't work. So, a couple options that I've heard. One is we could make it 5-year terms and arrange so that one term shall be expire each year, or we could say 3-year terms, so arrange that a minimum of 1 or 1 to 2 shall expire each year. And that would allow for this odd number of 5 and keep the term at 3 years. So those were the two questions I had, and I would be interested if there's any thoughts about either one. Yes, Paula.
My only concern would be about a vote, say, if someone were absent who was a voting member and there was a tie, it was a tie vote. We just need one associate member to step up and.
Oh, that's an interesting thought. So if we have 5 members, 1 is absent, there's 4, and there's a tie vote, then if we had associate members, we could ask one of them to be elevated to membership to vote on it. That's
Yeah.
a situational thing. Yes, Kevin?
I think Carrie had hers up first.
Oh, okay. It's hard to follow all these. Carrie, you're on mute.
So I'll just say,
Good.
the charter seems to be silent about associate members on other boards as well. So I'm not sure if there's a right, and that's what Kevin has the answer. But it also seems like the terms are, and I'm sure Kevin has the answer to this too, the terms seem to consistently be 3-year. So I've set you up, Kevin, and now I'm going to lower my hand and ask Rick if he wants to call on Kevin, I guess.
Yeah, go ahead, Kevin.
Yeah, so it does say it somewhere else in the charter, I forget where. It says it specifically that boards can decide to have associate members. They just can't have so many associate members as to make a, not a quorum, but to have more than what your quorum would be, right? So we can only have 2. We can't have 3. 3's being, 3 people being here making a quorum.
Okay.
So it is specified somewhere else in the charter allowing us to have. That's why you see none of the other boards have them really written in there either. Because of
Okay.
that.
Well,
And
that's
as
good to
far as
know.
the terms go, I think it's already set up, even though it's an odd number. So for example, I was given a 2-year term, Joan was given a 1-year term on Tuesday night. So Joan will come up again next year for reappointment. I'll come up in 2 years for reappointment with a normal one. And then at that point, it'll be a 3-year give for that.
Okay.
Does that make sense?
So what
There's
you're
none of-
saying is the volunteer committee can arrange the term so that there's always someone who is up for reappointment,
Yeah.
regardless of whether we have 5, and we can continue with the 3-year term, and they would just manage that.
Yeah. Yep.
Essentially. Okay. Okay, well, that's good. So it sounds like then, unless there are any other comments, we don't need to give specific feedback with respect to associate members. We have 2. We will continue to have 2 and leave it at that. And then it sounds like also the term issue can be managed, and we don't necessarily have to change things, which is a good way of doing it. Okay, so any other comments, Carrie? No?
Who is
So
our
I
other
don't-
associate?
Jerry is our associate, and we have a vacant position for
Oh,
a
okay.
second. Yeah. Okay, So that's good. That's very helpful in terms of feedback on that. And I turn it over to Aday for the monthly report.
All right. All right, Cassidy. So the blood pressure screenings are back. They're going to be held every first Wednesday of the month at the Pleasant Street Center, courtesy of Middlesex Essex Public Health Collaborative. So you all know about the SHARE grant. We have nurse Leanne from the SHARE from the collaborative, and she's going to be here first Wednesday of every month from 10 a.m. to 11 a.m. at the Pleasant Street Center, pretty much performing blood pressure screenings on the elderly. So we specifically chose the Pleasant Street Center because she's going to have access to, the senior citizens, which, they're the population that need it the most. So yeah, we're happy, to bring that back.
That's great.
And then April 18th, we're going to have the mammography van, Dana-Farber's mammography van. They're going to be back in Reading. They're going to be stationed at the town hall from 7:30 a.m. to 4 p.m. Pre-registration is required, and they accept pretty much all forms of insurance. Yeah, all you have to do is just, go to the website and register, pre-register for your mammogram. All right. In the month of March, we conducted 14 food inspections and 2 food re-inspections. We issued 1 food order, conducted 2 housing inspections, and 1 solid waste inspection. Cassidy, can you put up disease surveillance? And this is from March 15th to April 11th. We had 3 confirmed cases of tuberculosis. The patients were isolated and they are currently non-infectious. We had 9 confirmed cases of influenza and 11 confirmed cases of coronavirus, COVID-19. Again, we urge our residents to continue taking precautions and get vaccinated if they haven't. Simple precautions like washing your hands regularly, cover your coughs and sneezes, wear a mask if needed, keep your distance if you're around someone sick, and, stay home when you're sick. And that concludes the monthly report.
Yeah, Carrie.
Surprise. Ajay, I just wanted to clarify about the blood pressure clinics. So that they're held at the Pleasant Street Center, and you said their target audience is the elderly and folks who are.
It's everybody, but
Thank you. So you could,
everybody, but if they're right where they need to be. So
yes, right. So it's prime location for the primary audience, but that does not mean that other folks like me who
Correct.
isn't quite there yet, I could go in and get my blood pressure checked.
Absolutely.
Awesome. Thanks. I think that's great. What a
Aday.
great use of the shared services nurse. I think, that's such a useful and simple thing, and hard for a dedicated town nurse to fit in regularly. So great use to see.
Yes, and I would also like to thank Jenna for allowing us to do that. We've been collaborating on things, and I'm just happy that she's here.
Yeah, that's great.
Any other updates on the collaborative, Aday?
I know that Not Reading decided to opt out of the collaborative. I don't know how that's going to affect the funding for next year, but obviously, if we don't find a replacement, then they will probably cut the funds. But you know, hopefully we'll get somebody else to join us.
Can I
Yeah,
ask
Carrie?
if there was any feedback on why North Reading chose not to participate?
We didn't really get any feedback. We just got a well-typed email that sounds like it's from an attorney, not from the health director, you know. So
Interesting.
yeah.
Okay. All right, thanks.
Okay. No other updates, any other final comments or anybody? Nope.
Just welcome Joan, and I'm so excited that we are we are a body of 5 now, so
Yes.
we don't
Well,
have
thank you very much.
we don't have to avoid each other and when we when we see
Oh, man, it's, yeah.
Yeah, I've got to catch up on that open meeting law. Yeah, I've got some
Yeah.
reading to do.
Yeah,
well, it's a
Yeah.
little easier now because you can see
Yeah.
one of us and talk to us.
Exactly.
yeah.
Yeah. that'll
It
be
was a
nice.
real handicap having 3.
Oh, okay.
Mm.
And just a question for Joan, please. How do I reach you? Is it via email? What?
Email or my cell phone? Did you
Okay.
get my cell phone?
Um, not yet, but I'll get it.
Okay.
And congratulations to Kevin as well. Nobody's
yeah.
congratulating him. I don't know why.
Just another day. Just another day.
Yes,
He's been
Yeah.
waiting for this for like years.
You're real again, Kevin. You were always real.
You know me. My opinion got out there.
Oh, 100%.
And it was valued for sure.
Yeah. I mean,
Absolutely.
actually, I mean, Joan, I think that's the thing is while we had associate members, and we didn't really make distinction, right, Rick? It was really just in the matter of voting, you know, it
Just the
wasn't.
voting, yeah.
Yeah.
It's actually,
Yeah.
having
Input.
associates is a great, you know, you call it like your bench on a team, right? You have your starters that are out there, and then you have the bench players that, you know, can come in and supplement, and eventually they become the starters. And it's kind of,
Yep.
it's a good inroad to learn about the boards, committees, and commissions we have, is to go in as
Hmm.
as an associate. You have a non-voting role, but it's a great, you know, learning mechanism for that person. And then naturally, you know, it was always the thing that you'd want to promote from within, was always kind of the way it was looked at. So eventually they do become full voting members. And then they're knowledgeable when they do so, and they're well crafted when they do so. So that's the way it's worked before.
Hmm. It also
We have
adds
to
a,
find another
you-
associate member.
Yeah.
Knock
also
it up
adds
amongst
another
your friends.
viewpoint.
Actually, I know a girl who's a MPH, retired. I'll mention it to her.
Good.
Yeah.
Perfect.
And Dr. Lopez,
Still a vacancy there.
would you like to just let John know why you went from a 3-member board to 5? Or have you already talked to her about it?
No, I haven't. You know, it's primarily, there were a number of reasons, but you know, one of the biggest issues was that as I think Carrie mentioned, it didn't allow for any conversation or communication offline between, you know, 2 board members, because 2 board members was a quorum.
Oh, sure.
When you read the material on the open meeting law that I sent you, Joan,
Yes,
you realize
I
that-
tried to wade through it.
yeah, you do have to be careful, because a 2-way conversation that suddenly adds a 3rd person now becomes a quorum. And so you have to be very particular about that in both verbal communications and emails. And that was sort of the major thing. And then I think, as I mentioned, you know, more members, more input, more, and a lot of cities and towns have 5-member boards. Yes, Carrie.
Surprise. Just, just on that open meeting piece, it's like, we can create a quorum even if we're not all together. So if Paula and I were to have a conversation about a topic and then one of us were to speak later with Kevin, we've had, it's serial communication and that still counts as a quorum. So we have to be cautious about that.
Right.
as well.
Okay.
Or if you exchanged emails with Paula and then there was
Right.
a reply and then you forwarded the email to Kevin to say, what do you think about this? Now we have 3 people involved and it's a quorum.
And we have deliberated without the opportunity for public eyes on us and,
Correct.
Yeah.
so.
Right.
But if you want to call me, 3 of us about the Celtics, that's fine. Only about matters that come before this board. So
Right.
before another board, so just this board.
Okay.
It's okay. It'll be okay.
Yeah, we don't want you to run away.
No, don't run away. Don't run away.
No, I'm not going anywhere. I'm fine. I just need to read up on it, and it seems a little
Yes.
vague to me. So I think it's a vague to quite a few people. So
Yeah,
seems like
it's very easy to fall into the
Yeah.
trap.
Yeah, there's a learning curve, but you'll get there.
Yeah. It's just like working at a doctor's office. I don't talk to anybody about anything. So outside of the office, so that was my policy, with a HIPAA violation. So I just,
Right,
yeah.
right.
So,
Okay, so with that piece of education behind us, I'll make a motion to adjourn. Do I have a second?
Second.
Paula, second.
Oh,
Roll
that's right,
call,
Kevin, you can vote now.
Yeah,
Sorry.
roll call, Kevin.
Yes.
Paula,
Yes.
Carrie,
Yes.
Joan,
yes.
and Rick, yes. We are adjourned. Thank you
Right.
all.
Thank you, everybody. Have a good
Bye.
night.
Recording stopped.
Have a good
Good night.
Happy marathon weekend.
Yeah.
Bye.
Bye.